Previous year question paper, staff nurse, ISRO Vikram Sarabhai Space Center with the answer. Question number 1. The best method of destroying hospital waste is? Correct answer is option D, incineration. The best method of destroying hospital waste is incineration. Question number 2. Drying method used for preservation of food. Desiccation. Drying method used for preservation of food. Desiccation. Question number 3. The hormone that helps in maintaining fluid balance is ADH. The hormone that helps in maintaining fluid balance is ADH. Question number 4. A disorder of fifth cranial nerve. Correct answer is option A, trigeminal neuralgia. A disorder of fifth cranial nerve. Correct answer is option A, trigeminal neuralgia. Question number 5. In CPR, the compression ventilation ratio is 30:2. Correct answer is option C, 30:2. In CPR, the compression ventilation ratio is 30:2. Question number 6. Cardiac arrhythmia are seen in? Correct answer is option D, hypoclamia. Hypoclamia. Cardiac arrhythmias are seen in? Correct answer is option D, hypoclamia. Hypokalemia. Question number 7. Carbohydrates yield an energy at the rate of 4 kilocalories per gram. Carbohydrates yield an energy at the rate of 4 kilocalories per gram. Question number 8. Crossing over of optic nerves in the cranial cavity is called optic chiasma. Crossing over of optic nerves in the cranial cavity is called optic chiasma. Question number 9. Duration of one cardiac cycle is 0.8 seconds. Duration of one cardiac cycle is 0.8 per seconds. 0.8 per seconds. One cardiac cycle. Question number 10. Clotting factor 9 deficiency causes Christmas disease. Clotting factor 9 deficiency causes Christmas disease. Correct answer is option A, Christmas disease. Question number 11. The longest vein in the human body is? The longest vein in human body is long saphenous vein. Long saphenous vein is the longest vein in the human body. Correct answer is option D. Question number 12. Small pouch at the beginning of the thoracic duct. Cisterna chyli. Small pouch at the beginning of the thoracic duct. Cisterna chyli. Question number 13. A potent stimulant of the respiratory center. Carbon dioxide. A potent stimulant of the respiratory center. Carbon dioxide. Question number 14. Peritonsillar abscess is also called as quinsy. Correct answer option A, peritonsillar abscess is also called as quinsy. Question number 15. Exophthalmos is a feature of Graves' disease. Exophthalmos is a feature of Graves' disease. Correct answer is option C. Question number 16. Redneck syndrome is a side effect of vancomycin. Redneck syndrome is a side effect of vancomycin. Question number 17. A drug used in a patient in shock. Dopamine. A drug used in a patient in shock. Dopamine. Dopamine. Question number 18. Normal CSF protein level. Normal CSF protein level 15 to 45 per mg percentage. Normal CSF protein level 15 to 45 per mg percentage. Question number 19. Reflex control of respiration occurs in medulla. Reflex control of respiration occurs in medulla. Question number 20. An important postoperative care for a patient who has undergone staptectomy. Instruct the patient not to blow the nose. An important postoperative care for a patient who has undergone staptectomy. Instruct the patient not to blow the nose. Question number 21. Most common site of acute myocardial infarction. Anterior wall of left ventricles. Most common site of acute myocardial infarction. Anterior wall of left ventricle. Question number 22. Side effect of morphine includes decreased respiratory rate. Side effect of morphine include decreased respiratory rate. Decreased respiratory rate. Question number 23. Sign of hypocalcemia. Trouchet sign. Sign of hypocalcemia. Trouchet sign. Correct answer is option D. Question number 24. In ECG, recognizable QRS complex is absent in ventricular fibrillation. In ECG, recognizable QRS complex is absent in ventricular fibrillation. Question number 25. Most common surgical procedure for ulcerative colitis. Ileostomy. Ileostomy. Most common surgical procedure for ulcerative colitis. Correct answer is option A. Ileostomy. Ileostomy. Question number 26. The radioisotope used in bone scan. Technetium-99. The radioisotope used in bone scan. Technetium-99. Question number 27. Clinical signs of rejection after renal transplant include the following except increased urinary output. Clinical sign of rejection after renal transplant include the following except increased urinal output. Question number 28. World No Tobacco Day is observed on May 31. World No Tobacco Day is observed on May 31. Question number 29. The position recommended for a patient with epistaxis. Sitting and leaning forward. Sitting and leaning forward. the position recommended for a patient with epistaxis, sitting and leaning forward. Question number 30. Nerve supplying diaphragm. Nerve supplying diaphragm. Phrenic nerve. Nerve supplying diaphragm. Phrenic nerve. Question number 31. Heimlich maneuver is used to expel foreign bodies in the respiratory tract. Heimlich maneuver is used to expel foreign bodies in the respiratory tract. Correct answer is option C. Question number 32. Oxygen and carbon dioxide are exchanged in the lungs by diffusion. Correct answer is option B. Oxygen and carbon dioxide are exchanged in the lungs by diffusion. Question number 33. A patient with ascites should take a diet which is restricted in sodium. Which is restricted in sodium. Correct answer is option D. Question number 34. Enzyme present in saliva. Enzyme present in saliva. Amylase. Correct answer is option C. Amylase. Enzyme present in saliva. Amylase. Question number 35. Accidental removal of parathyroid gland during thyroidectomy produce tetany. Accidental removal of parathyroid gland during thyroidectomy produce tetany. Correct answer is option A. Question number 36. Primary effect of cold application. Vasoconstriction. Correct answer is option B. Vasoconstriction. Primary effect of cold application. Vasoconstriction. Question number 37. Gastric lavage is contraindicated after ingestion of which of the following? Correct answer is option C. Corrosive alkali. Corrosive alkali. Gastric lavage is contraindicated after ingestion of which of the following? Corrosive alkali. Question number 38. The sudden fall of temperature to normal is called crisis. The sudden fall of temperature to normal is called crisis. Question number 39. The most frequent cause of maternal death during childbirth is? Correct answer is option D. Hemorrhage. The most frequent cause of maternal death during childbirth is hemorrhage. Question number 40. Epidemiological triad comprises of agent, host and environment. Option C is the correct answer. Epidemiological triad comprises of agent, host and environment. Question number 41. Married couple where the woman is in the reproductive age group. Eligible couple. Married couple where the woman is in the reproductive age group. Eligible couple. Married couple where the woman is in the reproductive age group. Eligible couple. Question number 42. Osteochondral bleeding is seen in the deficiency of vitamin D. Osteochondral bleeding is seen in deficiency of vitamin D. Question number 43. Third generation IUDs are hormonal. Third generation IUDs are hormonal. Question number 44. Islets of Langerhans are present in pancreas. Islets of Langerhans are present in pancreas. Correct answer is option D. Question number 45. An example of a congenital cyanotic heart disease is tetralogy of Fallot. An example of a congenital cyanotic heart disease is tetralogical of Fallot. Question number 46. Fluoroscopic visualization of the urinary tract after injection with a radio opaque dye is called IVP. Correct answer is option B, IVP. Fluoroscopic visualization of the urinary tract after injection with a radio opaque dye is called IVP. IVP. Question number 59. Bluish discoloration of cervix during pregnancy. Correct answer is option C, Chadwick sign. Bluish discoloration of cervix during pregnancy, Chadwick sign. Question number 60. Salt losing syndrome is a feature of congenital adrenal hyperplasia. Salt losing syndrome is a feature of congenital adrenal hyperplasia. Correct answer is option A. Question number 61. False ideas or beliefs that the patient accepts as real are called delusion. Delusion. False ideas or beliefs that the patient accepts as real are called delusion. Question number 62. Flashbacks of an unpleasant, terrifying or painful experience may occur in. Correct answer is option B, PTSD. False flashbacks of an unpleasant, terrifying or painful experience may occur in PTSD. Question number 63. Gamophobia means fear of marriage. Gamophobia means fear of marriage. Correct answer is option B. Question number 64. Burning and tingling sensation of feet in an alcoholic is suggestive of peripheral neuropathy. Correct answer is option A. Burning and tingling sensation of feet in an alcoholic is suggestive of peripheral neuropathy. Question number 65. Chronic exposure to poor lighting causes minus nystagmus. Chronic exposure to poor lighting causes minus nystagmus. Question number 66. The size of respirable dust is 5 microns. The size of respirable dust is 5 micron. Question number 67. Largest immunoglobulin is IgM. Largest immunoglobulin is IgM. Question number 68. Frequent swallowing in a patient following tonsillectomy indicates hemorrhage. Frequent swallowing in a patient following tonsillectomy indicates hemorrhage. Question number 69. Neurological injury in a newborn known as kernicterus is due to unconjugated bilirubin. Neurological injury in a newborn known as kernicterus is due to unconjugated bilirubin. Question number 70. The following should be specifically monitored for administering 4-mannitol safely. Correct answer is option D. Urine output hourly. urine output hourly is the correct answer. The following should be specifically monitored for administering 4-mannitol safely. Correct answer is urine output hourly. Question number 71. The amount of blood filtered in renal capsule per minute is called glomerular filtration rate. The amount of blood filtered in renal capsule per minute is called glomerular filtration rate. Correct answer is option B. Question number 72. Bagasosis is caused by inhalation of sugarcane dust. Bagasosis is caused by inhalation of sugarcane dust. Question number 73. Fracture of the distal radius is called Cooley fracture. Fracture of the distal radius is called Cooley's fracture. Question number 74. The following is a contraindication for bag and mask ventilation. Diaphragmatic hernia. The following is a contraindication for bag and mask ventilation. Diaphragmatic hernia. Question number 75. Phosphate test is used to test the efficiency of pasteurization of milk. Phosphate test is used to test the efficiency of pasteurization of milk. Question number 76. The most common complication associated with mumps is aspertic meningitis. The most common complication associated with mumps is aspertic meningitis. Question number 77. The performance of ASHA workers is monitored by reduction in infant mortality rate. The performance of ASHA workers is monitored by reduction in infant mortality rate. Reduction in infant mortality rate. Question number 78. The classic sign of raised ICT is bradycardia. Classic sign of raised ICT is bradycardia. Question number 79. Stearia indicates abnormal digestion of fats. Stearia indicates abnormal digestion of fats. Correct answer is option C. Question number 80. The maximum score of Glasgow Coma Scale is 15. The maximum score of Glasgow Coma Scale is 15.